This is Ashley Brown. As you can tell, she is very frustrated. She has just come from the doctor's office and has a prescription for propranolol. She doesn't want to take any medication and doesn't know why her doctor seems to think she needs to. Keep in mind her physician doesn't have a lot of time and did not properly advise her on this medication. What will she do?
What will I do? Well, I guess I can look up this medication online before heading to the pharmacy. I don't want to get this prescription filled if I don't really need to take it. And I've heard about this website called WebMD on commercials on the television, and I bet you it'll have a lot of useful information. Let's see, propranolol. Oh, okay. So it's going to be used for blood pressure medication. My blood pressure has been on the high side after starting pharmacy school recently. Oh my gosh. I'm so confused and worried now. The side effects are really scary. I could turn blue, have a slowed heartbeat, stop breathing, have mood changes, and an increase in thirst. It sounds like I'm going to be turning into a vampire. Or maybe I'm just watching too much True Blood.
She has found out is that while WebMD is one of the most advertised sites for finding patient information, it's not one of the most helpful. But she knows that her local pharmacist will have the information she needs.
I'm really sorry that this medication is causing you diarrhea. Would you like to be on hold, please, so you can talk to the pharmacist? Okay.
Hi, my name is Ashley. I was just wondering if you have a few minutes to talk to me about this new prescription I was just prescribed.
Sure, Ashley. I'm Genova, your local pharmacist. What questions do you have for me?
Well, you see, my doctor just wrote me this prescription for propranolol, and I just want to know what are some side effects and some information about it before I make my decision on whether or not to fill it. I looked it up on WebMD, and there was some pretty scary information on there, and so I was just seeing if there was any advice or further information that you may have to help further my decision-making process.
Sure, I can do that for you. I can get some information up. Do you mind having a seat while I look it up for you?
No, that's fine. Yeah.
Okay, hold on one second.
Okay.
Super Tech, can you bring me a package insert for propranolol, please?
Package insert.
Here you go. Take a look at this while you wait.
Okay, thank you.
As you can see, Ashley is having trouble reading the package insert. She can't understand everything in it because it's not exactly patient-friendly. It's oriented more towards healthcare professionals, like physicians, pharmacists, and nurse practitioners. Hopefully the pharmacist is having luck finding the information for our dear, befuddled patient.
How long does it take to fill a prescription? This is ridiculous. So frustrating.
According to case studies found on PubMed, one off-label use for propranolol is for aggression.
Oh, Super Tech, do you mind coming in the back and helping me get this information for this patient?
Sure. I'm finding a lot of cool off-label indications, side effects, drug interactions, and pharmacokinetics on PubMed.
I'm surprised you're finding stuff on there. You don't want to use PubMed. That site is difficult to navigate, and the scientific context is way too advanced for the average patient. Oh, and have you checked some of those publication dates? Some of those findings are not timely at all.
But these case reports and clinical trials are firsthand.
Yeah, but in my experience, most of those findings are pretty biased.
The pharmacists in SuperTech have just discussed the advantages and disadvantages of using PubMed, a primary resource. Let's see what they found on 2 websites intended for healthcare providers.
Here, come take a look at these 2 sites, Micromedics and Drug Facts in Comparison. These are the types of sources you typically want to use when you start practicing on your own. They are great for healthcare professionals. I just wanted to show you those, but you still don't want to suggest these sites to your patients because it's not targeted to them. The information is complex and embellishes on the information found on the package insert.
Wow, there are so many off-label uses. The
Mhm.
patient may be overwhelmed if she saw this.
That's right.
And Micromedics lists a plethora of drug interactions. Ashley might think she can't take any other medication when she's on propranolol.
Good work, Super Tech. Let's keep looking.
Here's a patient-friendly site, RX list, that both us as providers and patients can use.
Wait. This info looks exactly like the package insert. This website isn't going to help her at all.
So, oh, well, no, what are we going to give her now?
I will just compile the information and explain it to her, and that way she might understand. Brown to the pharmacy, please.
Thanks so much for doing this for me again.
Oh, no problem. Here you go. Here's the information I've compiled for you.
Okay.
I hope that makes you feel a little less skeptic about taking your medication propranolol. What other questions do you have for me?
Well, how about I take all this information home and read over it, and then if I have any questions, can I call you?
Oh, yeah, that's fine. Sure, go
Okay.
ahead.
Thanks so much.
Alrighty, come back and see
Will
us.
do.
Next, please.
Hi, I'm here to pick up my prescription for propranolol.
And your last name, please?
Uyoon.
Super Tech, prescription pickup for you, please.
I think a prescription.
Ah!
Oh, no!
As you can see, one of the off-label uses for propranolol is in treating post-traumatic stress disorder.